Hey,
Hello, I'm a student nurse. Do you mind if I follow you around today?
no problem. You sure can. We have a patient here today, Charlie Temple. Um, she came in with hyperlipidemia, so we're going to be administering a medication to control that.
Okay, I've got a couple questions for you.
Okay.
Why specifically is this client receiving this medication? What action does the medication have on the body?
She's getting Lipitor. That is to lower her levels, to control her levels of lipids. So we want to make sure that her all of her lipids are correct. The action that it has on the body, it can cause vasodilation. It lowers the low density lipoprotein production and increases the hyperlipidemia. Hypo. No, it increases the level of high density lipoprotein, and it prevents inflammation of plaques that may have built up in the vessels. And those are the main actions that it does.
Okay. When should you question administering this medication? Does it have a therapeutic serum level?
No, it doesn't have a therapeutic serum level. You should question giving this medication if the all her levels are okay. If her low density lipoprotein is less than 130, then she's okay. If her high density lipoprotein is higher than 50, then she's within a normal level. Then we wouldn't be administering the medication.
Okay. Which vital signs must be monitored?
We will be continually monitor blood pressure and normal vital signs. There's not like a major one. Of course, having those lipids abnormal in the body could cause other problems like myocardial infarction and things like that. Then we would be monitoring the vital signs. But to administer this medication, just normal blood pressure and heart rate.
Okay. Which physiological parameters should be monitored when the medication is being administered?
Um, you just want to make sure that the patient doesn't have any type of allergy and that it's administered correctly. There are no major in the patient to look at, but you would be looking at triglyceride levels, LDL, HDLs. Those are the main ones.
All right. I've got a lot of questions.
Okay.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
In a hospital setting, like I said, we'll be looking at those levels, make sure that those are if we're controlling them and they're a normal level. If they're too high, too low, we continue to administer medication. Maybe notify the physician if there's a big change to the bedside, and those are mainly it. It's mostly to control the cholesterol and maintain the normal level.
All right. Um, how about what interventions must be taught for taking the medication safely at home?
We'll be maintaining just to make sure that they're following the prescription and they're not taking more than they should. If the medication is orally, which it should be at home, they make sure that they can swallow, that they follow the schedule of the medication. If it's twice a day, take it twice a day at the time that they're supposed to. But mostly those, they can't monitor the LDL at home, so we would probably have to go to the lab and have them check that for them. Those are mainly.
Okay. What are the side effects and potential adverse reactions?
They could have muscle pain, and they could have peripheral neuropathy that comes with this medication. So those are two main ones that we should be looking at. It could cause weakness and numbness too. So we just want to make sure that she doesn't get that.
Okay.
Okay.
All right.
Any more questions?
One more. How will you know the medication is effective?
You're going to be looking at the cholesterol level, making sure that the high ones are staying high and the low are staying low. We want to maintain a good level. So those are basically it.
Cool. All right. That's all the questions I have for now.
Okay. Let me just get ready here so we can go in. Let me see if I do. All right. So we're going in. So, Charlie Temple,
Yes.
how are you doing? Come on in.
Oh, I was just sleeping.
All right, my name is Hednan. I'm the nurse on the floor, and I have Kevin here, who's a student.
Hi.
Is that okay if we come in to administer your medication?
Yeah, of course.
All right. So, I'm gonna wash my hands. Put some gloves on. Can you tell me your last name?
My last name is Temple. Shirley.
Shirley Temple. And how old are you? Are you still 62?
Yes, 62 years young.
Okay. You have any allergies? No.
No.
I don't see any here.
No,
So.
I don't. I'm good.
Okay. So what I have here for you is Lipitor.
Lipitor, okay.
Lipitor. Do you take this medication at home? You've been
Yeah, I think that's for my cholesterol, right?
Yeah.
Yeah.
What this medication does is it maintains a safe level of your cholesterol.
Okay.
There's some cholesterols we want high and some cholesterols we want low. What it does is it maintains them.
Okay.
And right now your low density lipoprotein is a little high. We're going to try to bring that back down.
Okay. That's the bad one, right?
Yes.
Okay.
You want it to be low. You want that one to be low, and it's a little high on you. It's not too high, but we want to bring it down to a better level. Okay.
Okay.
So we got the name. The name is here. We have 40 milligrams of Lipitor. This is what we have here, and what we have on the computer is 40 milligrams. We're good there. It is the right time. It's Monday 9 o'clock. It is Monday 9 o'clock. And it's the right order. Okay, I think we got it all correct. Some of the side effects of this medication is muscle weakness and muscle pain, and peripheral neuropathy. Do you have any problems like that when you take it? Have you had any
no.
Any pain on your muscles because of this?
I mean, I'm just sore, but I think it's just, I'm a little older.
Okay.
Peripheral neuropathy, is that like tingling and stuff?
Yeah, you will feel like some pain on your legs.
Oh, okay.
So.
Yeah, no, I haven't had any of those. I haven't had any problems with taking that medicine. I just have problems with my diet.
So here we go. You have some water there.
Okay.
You wanna?
Yeah.
All right.
Thank you.
No problem. Are we good?
Mm-hmm.
Okay.
Down the hatch.
Okay. So we'll be checking on you. They will continue to draw your labs to make sure that your cholesterol has gone to normal, and we'll do that on a daily basis and make sure you're doing okay. You don't go any higher than that.
Okay.
You have any questions for me or Kevin?
Well, I think I really do need to change my diet, and my doctor said that he would have a dietitian come in because
I can probably put a consult in for a dietitian.
Okay.
And maybe we'll go over some of the
eating
things you can and can't eat, or
yeah, too much fatty
That'd be good.
foods, too much fast food.
All right, I'll put it in. So
okay, good.
Maybe they can come in if they have an opening today or maybe tomorrow.
Yeah, whenever. I just think that would really help me.
All right. So on this hospital stay, we'll take care of that.
Good. That would be awesome.
All right. You have your call light. If
I do.
You need any help, just let me know.
I think I'm good. I feel good.
Good. All right. So we're out of here. Let us know if you need help.
Okay.
Thank
I will
you.
give you a call. Thank you. Bye, student. Good luck.
All right.
Thanks. Bye.
Oh, what was this here?
So
how was it?
It was very cool.
All right.
I've got a couple more questions for you.
What's up?
Okay. If there were any pertinent pieces of information you reviewed before administering the client the medication, what were they?
We looked at the LDL and HDL. We looked at triglycerides, and right now her HDL is a little off, so we're trying to get that fixed. And her triglycerides and her LDL are okay, but we're trying to fix the high density lipoprotein, and that's what we looked at.
All right. Did this information affect your decision to administer the medication?
No, it did not. It was high. We have it was a bit off, so we have to bring it back to normal.
Did any of this information affect how you administered the medication?
No, it was administered. She needed the medication, so she got it.
All right, that's all I
it. You
have.
have any more questions?
No, sir.
All right, thank you.
Thank you. Bye-bye.